When living with lung cancer, conversations in the doctor's office aren't always easy. To help people with lung cancer and their healthcare providers build stronger relationships and have more open conversations around screening and treatment, we switched their voices. Each read real quotes from the other side's perspective, stepping into one another's shoes to create understanding and empathy.
I've been working with lung cancer patients for about 20 years. So you can only imagine the changes I've seen in treatment and survival.
I was diagnosed with lung cancer several years ago, and I'm still here.
It's important for me to have a good relationship with my patients so they can feel comfortable sharing their feelings. It's important that the doctor and the patient are on the same page.
Feeling like we're working together went a long way towards making me feel better about the relationship. It made a huge difference for me personally. I felt like the more I knew about it, the better armed I was to cope with it.
My patients aren't just another visit or another number. You're going to do the best you can. You're going to advocate for them. We provide what we call patient-centered care. They develop a trust in you.
The first thing that healthcare providers can do to make their patients feel empowered along their cancer journey is to communicate. That's the number one thing I hear from patients. Well, I just wish they would have spent more time and told me and explained it a little bit clearer.
I think it's important that you're confident about your own feelings about your own body. And it's important that you communicate everything you're feeling to your doctor and not be afraid of what might be on the other side of that.
I have been living with lung cancer for 3 years now.
I am a specialist who's been treating lung cancer patients for over a decade.
When I was first told I had lung cancer, all that I can remember was silence for a few minutes. It felt like an eternity of silence.
I know that it's a lot to take in, but that's why we want to encourage the patient to speak up, to ask questions, so that the patient really gets a full understanding of the disease and the situation.
Looking back, I wish I could have gotten more support. I wish I would have been told that I wasn't alone. And I have learned that I will advocate for myself. I will speak up.
What I will say to a patient is this is an overwhelming time and I know you feel vulnerable, but you are the CEO of your own health. You have to be the one to be able to ask questions and challenge things that you don't understand and make the final decisions. It's really important.